everybody, to the Dr. Carolyn Dean Live radio show, featuring Dr. Carolyn Dean, along with host Ginny Sanders,
also known as Ginny Almighty,
who joins Dr. Dean on tonight's program. Phone lines are now open at 602-666-6027. That's 602-666-6027. And we'll be taking your calls from around the world and right here in the USA.
Welcome everyone, live with Dr. Carolyn Dean here this Monday, January 27th, just to give a place marker for those who might be listening to our archives. We're happy to have all of those who are listening to us live this evening for this glorious, wonderful 2-hour radio show, which interestingly enough becomes more and more relevant. Dr. Dean and I have been doing this radio show for almost 9 years now, but I'll tell you, every single week as the growing panic and fever of environmental challenges and the physical symptoms that people are having become excruciatingly more serious, her information becomes extremely more relevant, not only because of her incredible wisdom and the amount of time that she's been working as a medical doctor and as a naturopath and in the field of medicine and leading the charge at the health freedom movement and being involved with decision-making around the world and doing research and developing products and running her own company and every other thing that she does. But she's infinitely wise and on top and even sometimes ahead of what's happening in the world. And there's a lot of interesting things happening right now that we're going to be talking about on the radio show tonight. But most importantly, what we're going to be talking about is your health, your body, your questions, live radio show, call, talk, chat, gather information, do your due diligence, run it by your own healthcare practitioner, and then execute. Make good decisions for yourself. This is the time to be paying attention to these kind of things, and we're so glad you're tuned in tonight with us. For those who are new, well, let me just run through the format of our show. Again, 602-666-6027 is the call-in number. You can call and speak with Dr. Dean this evening. If you've not spoken with her before, she is absolutely delightful, and you'll want to do it. And we'll be taking your calls after we do our opening topic, which we do every week based on the blog that Carolyn will be talking about. We also have roundtable discussion of all the pertinent topics, and then we mix in your live calls with our mailbag over the course of the balance of the show. If you want to chat with us on our chat line, you'll see that right here at the station, and you can just type in your questions on the chat panel. And also, again, if you're listening to this archive and you want to talk with Dr. Dean after the radio show is no longer live, you can send your questions to questions, questions, at Dr. Carolyn Dean Live, which is Dr. Carolyn, Carolyn, DeanLive.com, drcarolyndeanlive.com, which is our radio show blog and archive. So, again, just absolutely deliciously, delightfully happy that you're here. So much good stuff to talk about and so much good news for you, our listeners. We just want to jump in and get started this evening. And so let me bring on our absolutely delightful, very own Dr. Carolyn Dean. Yeah, there.
Yes, very good. The children agree. Not until the children agree will I come on. So there are the children. Thank you, Ginny. Another wonderful introduction. Yes, let's get right to it. There's a lot to talk about today. I'm going to start every show with this. Refer your practitioner to us so they can get a free practitioner kit to introduce them to what we're doing. Ask yourself the question, what if your doctor knew about REMAG years ago and told you about it? So we want you to pass that information on to your doctor so other people can learn about REMAG a decade before they are now. Number 2, referral candy. You'll get an offer to have a 15% discount for you and a friend you refer. That'll help with shipping. Number 3, get your blood testing done. There's a home blood test kit. It's a research project that we're doing. You go to rnareset.com and just click on research. And after you register and after you get your first test results, within 30 days you'll get a coupon that you'll submit, and the total value of these coupons will be the cost of the test. So it's like you're getting a free test. And number 4, we're talking each week about our magnesium deficiency survey. We're up to about 13,000 people now who are answering the basic 6 questions about magnesium deficiency. And here's the survey results. Do you experience anxiety? Yes, 65%. Do you experience insomnia? Yes, 63.2%. Do your muscles cramp often or easily? Yes, 51%. Do you experience heart palpitations? Yes, 47.4%. Do you experience restless legs? Yes, 41.8%, and that's the topic of our talk or our opening tonight. Do you experience headaches often? Yes, 29.9%. So restless legs, 41.8%. A lot of people have restless legs. But before we dive into that topic, one of our customers, Nancy from Vancouver, asked if we could focus on the coronavirus. What would you suggest to prepare for the potential spread of this virus in North America? And she says, I enclosed the contents of an email I received just this evening from the Orthomolecular News Service for your comment as well. Well, I guess Nancy doesn't realize that I'm on the board of the Orthomolecular Medicine News Service, and we hashed this out over the weekend, what we'd recommend to our audience, to the world audience, about this coronavirus infection. Now, they're already calling it a pandemic. They're already scaring the wits out of people. And the orthomolecular people, even though orthomolecular means the right molecule, it's become known as the high-dose vitamin C medical news service. And that's fine because high-dose vitamin C, which is really just ascorbic acid, has powerful antiviral effects. So what the OMNS put out was that in order to prevent getting this virus, we should be taking 3,000 milligrams or more daily of vitamin C, 2,000 to 5,000 IUs of vitamin D3, 400 milligrams of magnesium as citrate, malate, chelate, or chloride, but of course I would say at least probably double that. Zinc, 20 milligrams daily. I would suggest our Remite, which does have zinc, and it's balanced out by the other minerals, including selenium, and they recommend 100 micrograms of selenium. So what we've done with our Whole C Reset, our vitamin C, our Remag, and our Remite is given people the opportunity to cover themselves with these nutrients, and they've all been proven to be effective to strengthen the immune system against viruses. We don't sell a vitamin D3, but I would recommend the plant lichen D3s. I've increased my D3 since my vitamin D3 level was low. So people can take 2,000 to 5,000 units of vitamin D through the winter to prevent infection. So that's the recommendation, but of course we would be adding and do take Pico Silver. We didn't talk about that with the OMNS. I think it's because this is a worldwide post, and perhaps some countries don't even know what silver is as an immune booster. And with the silver, that's going to be 2 and 3 teaspoons a day. And if you get sick, could be 1 teaspoon hourly. That's what I would take. So that's the coronavirus. And then the next topic, and I have my questions out of order here. Let me just click down to Ginny's blog that she put out today, was about restless leg syndrome. And years ago, I put out a blog about restless leg syndrome, and I said, I made some passing remark that it was kind of a made-up condition so that they could treat people with drugs. And I said it was mostly magnesium deficiency, and I got a blowback from people in restless leg forums who said I was making light of their condition and they needed drugs to treat it. So I apologized for that back then, and we keep tackling restless leg syndrome because we tell people to take Remag for it, and they do get better. And the blowback or feedback that I was getting back at the time, I don't even know if Remag was on the shelves, but people were saying that they would try magnesium and it didn't work. And, of course, what we've heard from people since is once they go on Remag, their symptoms resolve, whereas other magnesiums did not work for them. So it's a matter of absorption, getting the magnesium directly into these cells. So, as our survey says, 41.8% of people indicate they experience restless leg syndrome. It's a sensory motor neurological movement disorder affecting 12 million Americans. That's pretty huge. And I don't even know if I learned about it in medical school, seriously. It just wasn't something on the top of the list. And when that occurs, when conditions are sort of revealing themselves over the decades, I do attribute it to magnesium deficiency becoming more and more prevalent. Continuing, many healthcare practitioners are not familiar with RLS, and its symptoms can be easily obscured among other health conditions like insomnia and heart disease. The most practical way to say it is, medicine has no idea what causes RLS or how to treat it. Sorry, a bit of an edit there. Some of the latest studies on RLS just make people with the condition more anxious because they've been told there's no cure for it, and now they're being told that it raises their risk of heart disease. So the symptoms occur at rest while a person is lying or sitting, and includes creeping, crawling, tingling, pulling, twitching, tearing, aching, throbbing, prickling, or grabbing sensations in the calf muscles. The result is an uncontrollable urge to relieve the uncomfortable sensations by moving the legs. So the legs become restless to try to relieve the crazy, creepy symptoms. And right now there's a long list of drugs being used for RLS. For a condition that may be due to magnesium and or mineral deficiency. The drugs, they're dopamine agonists, Requip, Mirapax, Nupro, dopamine agents like Cinnamon used for Parkinson's, benzodiazepines, which can become addictive, even opiates, are being used, anticonvulsants like Neurontin. We hear a lot about Neurontin. People then get kind of addicted to Neurontin, can't get off. Alpha-2 agonists such as Catapress, and a huge long list, and a huge list of side effects from all these drugs. So then continuing on, when a chronic or a difficult-to-remedy condition responds to REMAG, people are stunned, especially when they've tried other forms of magnesium. With each new testimonial, it's obvious that many magnesium products are not well enough absorbed to give the therapeutic levels offered by REMAG. For example, this testimonial highlights the relief from RLS and the absorption of REMAG. Someone says our RNA reset drops and REMAG arrived. I'm astounded because after taking 1/2 teaspoon of REMAG, my RLS was much, much better last night. She wrote back the next day, I'm very amazed. Again, last night I had almost no RLS symptoms. I usually have RLS all night long, every night, and even at 5 a.m. when I awaken, and sometimes during the day when I'm relaxing. In order to get to sleep, I take several natural sleep aids, but almost never sleep for more than 2 hours at a time. And on, the side effects continuing into the next day. Tried many things, and nothing has really worked at all, not even life extension magnesium. So this is very surprising to have 2 nights with almost no symptoms. Now, what I'd say here is this was on a 1/2 teaspoon, and it went right to her most dramatic problem. But if that customer just keeps taking a 1/2 teaspoon, after a week or so, the symptoms may come back because you have to increase the amount to deal with the symptoms and also the other 999 different enzyme processes in the body, and also to build up your magnesium stores. So please don't think that a minimal dose is going to take care of symptoms from here to eternity. You really have to saturate with the magnesium, and then after saturation, which could take a year or more, then you cut back to the point where, as I often say, I'm only on my 1 teaspoon a day now, whereas I had to take 4 in the past. The final paragraph in Ginny's blog, some research shows that people with RLS may suffer from iron deficiency. However, only 15% of the RLS clinical population appears to have peripheral iron deficiency. Yet, whatever. In addition to supplementing with REMAG, using an iron supplement for peripheral iron deficiency is an option, but people have to be careful in so doing because you can build up too much iron in the body. I would say along with the REMAG, take your Remite. It does not have iron. And also take your B vitamins in the Realign because the Bs help with the nervous system and the adrenal glands. Okay, let's go through the blog questions, but first this testimonial. Thanks to my angel, Dr. Dean, that is saving my life and the lives of my relatives and friends. I order so many for my family in Mexico. I put them on REMAG and now Remite, and they're doing much better. I've been taking REMAG, Remite, and Realign for 4 months, and my health has improved significantly. I'm off metformin, lisinopril, Bistolic, and Lipitor, and I feel so much better now. I pray to God every day that to give Dr. Dean all the wisdom she needs to save us from the pharmaceutical mafia. Blessings to all of you. Okay, so let me go to the blog questions. I've got everything all jumbled up here, but let me stop first and see if Ginny has any comments before I go to the mailbag.
Well, just the comments are related to, once again, people are interested in knowing about their dosing and that kind of thing. So we'll see how you hit on all those topics as you do the mailbag. One quick backup is, what is the brand name of the plant-based vitamin D you're recommending?
I'll go to my cupboard and look at that. I just get it on Amazon. It's a plant lichen. I went to it because I just don't want to take the sheep lanolin vitamin D. It just doesn't sound so appetizing. So it's vitamin D3 by Naturello.
Naturello. Okay, that's the one. Yeah, Naturello. That's the one that Barbara posted. Okay. And now, the reason why you're using this versus the Blue Ice Royal cod liver and the omegas and the A's and stuff like that is because...
Well, I still use my Blue Ice Royal for the omega-3 fatty acids and the vitamin A and whatever vitamin D I can get, but we don't have a number on the Blue Ice Royal. We don't know how much we're taking, so we never knew how much we're getting. And with the blood testing that we're doing now, the home health kit, my vitamin D level was low, and I'm not getting it. I don't go out in the sun here. I suppose I should a bit. So I wasn't getting enough vitamin D. So I'm doing my experiment. I'm taking some extra vitamin D, and I'll take my blood test after 6 months and see if it shifted.
Okay, very good, very good, very good. Okay, and also, so let's go with that and then see how you answer some of the questions that come in as far as dosing and that kind of thing is concerned with the folks who are doing the REMAG already and still feeling like they have symptoms of, restless leg or cramping in their legs and that kind of thing.
Sure. Okay, number one. I'm a healthcare professional who has RLS. I currently take 1 milligram clonazepam nightly to sleep due to leg movements. I take magnesium glycinate, though inconsistently. In the past, when trying to discontinue the clonazepam by using magnesium, it hasn't worked. Can you tell me what kind of magnesium is best for RLS, and how do I know what dosage to use? Yeah, so the perfect question from Ruth. Basically, REMAG, because it's a stabilized ion of magnesium, it gets directly into the cells. And on the heels of the REMAG ions, it pulls in water. So that's why we tell people to drink their guidelines of water, get their body weight in pounds, divide that in half, and drink that many ounces of water a day, along with a quarter teaspoon of sea salt, a natural sea salt that has some color to it, not a refined white sea salt. So with the quarter teaspoon of sea salt in every liter of their drinking water, you get those minerals. You get the water into your cells to make the magnesium work. You hydrate yourself. Now, the dosage for Ruth, because she's already on a medication, the body has to detoxify that medication every minute of every day, then it could be like 3.5 teaspoons of REMAG. But I'd also say get your Remite going, 1.5 teaspoons. Take your Reline for your B vitamins. Are you eating a lot of gluten foods and sugar? So there's all those things that can affect the health of the body. You just look at the whole picture. Read any one of my books to go into the different health benefits of a yeast-free diet, for example. If you have yeast overgrowth, you're going to have a lot of irritation of your nerves and muscles that can aggravate restless legs. Next question. I've had muscle fasciculations in both my legs for 2 years. It is constant, and I've been taking different magnesium supplements for over a year as well with minimal improvement. I have many of the other symptoms of magnesium deficiency, including muscle cramping in bed when trying to flex or extend my ankles, anxiety, severe fatigue, muscle fatigue. I just started REMAG about a week ago, was wondering how long it would take to see signs of improvement. I had improvement the first night with REMAG, and now it seems to have tapered off. I did order Remite as well, haven't received it yet. And then her magnesium RBC was 5.5, but she had just taken her magnesium. So this is Heather asking how long and how much. And yes, it'll improve. You will improve at the onset, and then you have to keep increasing your dosage. And yes, our label does say to take just the RDA, but that's because the FDA tells us to. We're not allowed to tell you anything about REMAG being therapeutic. But what you'll learn from our testimonials, you'll hear in the radio show, you'll read our blogs, that it is a matter of increasing your mineral saturation. It's not just taking these minerals as if they're a drug to suppress the symptoms and then you quit them. This is a long-term commitment to your body to get the minerals that we've been missing from our diet. A mother asks, is there a difference between restless leg syndrome and hypnic jerks? My 15-year-old son has what I think are hypnic jerks throughout the night. I've read that they're harmless, but I have to believe they're preventing him from getting a restful sleep. So a hypnic jerk is an involuntary twitch of one or more muscles that occurs as a person is falling asleep. It tends to happen just in the transition from wake to sleep. Involuntary muscle movement is also called myoclonus. Hiccup. Listen to this, Ginny. Hiccups are a common form of myoclonus. Now, I didn't realize that. I used to get a lot of hiccups back in my magnesium deficiency days, so that is very interesting. So yes, of course, anything to do with muscles and nerves not behaving properly is magnesium deficiency until proven otherwise. So it's a matter of just taking the REMAG and drinking water, maybe with some juice added for the taste, using REMAG lotion on the body. With kids, I just tell them to do the REMAG and see if that's enough for them. I know a lot of athletes, young athletes, I'll get them on the REMAG and the Remite as well. Someone says, who's this, Paula? I have RLS and have tried ropinirole and gabapentin and hated both. I do slather myself daily with your magnesium lotion, and I try to take the REMAG Remite daily. So that's not good enough. You can't try to take it. You really have to take it. You have to get up in the morning, pour a liter or big tall glass of water, put in your 2-3 teaspoons of REMAG, your teaspoon half of Remite, put in some juice or some stevia for the taste, and just gulp a few swallows down every couple of hours and follow that with a plain sea salt water chaser. And, you just hold your breath for a second and it's done. But you have to do that. And Paula continues, I do think the B vitamins help significantly in addition to the magnesium. So that's our Realign. Hopefully she's using that. Yet I still go through periods where it's maddening to wake up at 1-3. Well, you're not taking enough. And, you're just not taking enough. It should be 3 teaspoons of REMAG, a teaspoon half of Remite. Okay. Next question. Everything I've read about restless legs says it's an urge to move the legs, i.e. a voluntary movement. I have involuntary movements on occasion and learned there's such a thing as PLMD, and I looked that up, and it's periodic limb movement disorder, a condition that was formerly called sleep myoclonus or nocturnal myoclonus. That's the word that we used with the hypnic jerks. It's described as a repetitive limb movement that occurs during sleep and causes sleep disruption. Movements usually involve the lower extremities, consisting of extension of the big toe and flexion of the ankle, the knee, and the hip. In some patients, the limb movements can occur in the upper extremities as well. And this is interesting. They occur most frequently in light or non-REM sleep. They're observed in 80% of patients with restless legs and can occur in over 30% of people aged 65 and older. And they can be asymptomatic. And of course, the first line of treatment is a dopamine agonist drug, and whereas we say, well, do the REMAG and prove to yourself that it is or isn't a magnesium deficiency before moving on to medications. And someone writes in, I'm currently using 2.5 teaspoons of REMAG daily. I have restless legs. Should I increase to 3 to 4? Oh, 2 half teaspoons. Should I increase to 3 to 4 half teaspoons? Well, the dosage, Jack, is, I'd say, like 3 whole teaspoons. And also to take your Remite and make sure you're drinking your sea salted water. Someone says, I've been using 2 ounces a day of REMAG for a couple of years now. Now that, I don't think that's possible. 2 ounces a day, an ounce is it 2 or 3 tablespoons? So let's see, 2 ounces in teaspoons. 12 teaspoons. Now, this person is not taking 12 teaspoons a day, I can assure you. I still have what I think is RLS. Well, you would have a lot of diarrhea if you were on 12 ounces of, or 12 teaspoons of REMAG. Legs jump, intense achy itch is the best way I know to describe it. And then how do people on your show keep saying about REMAG giving them diarrhea when I have the opposite problem with all this magnesium on basically a fruit and vegetable diet? So, Mary, you're going to have to phone in or phone into the show, or at the very least email into support@rnareset.com and tell us what exactly you're taking, because what you're saying doesn't really make sense. And I can't really spend time speculating. Someone is saying, I have high blood pressure. My doctor has me on this Prolol, which sounds like a beta blocker, 10 milligrams for heart palpitations, hydrochlorothiazide, and amlodipine, the iodine hypertension drug. I don't want to be on these meds. I currently take REMAG Remite. I ordered Pico Silver. What could you do if you're experiencing tingling, pins, and needles in your arms and legs, but sometimes feel like it's over your whole body? So I haven't been doing this enough lately, but I went to the drug she's on and looked up the Prolol side effects: anxiety, blurred vision, burning, crawling, itching, numbness, prickling, pins and needles or tingling feelings, change in consciousness, cold, clammy skin, cold sweats, confusion, cool, pale skin. So your symptoms of tingling, pins, and needling could be the beta blocker, and your iodine drug here side effects: black tarry stools, bleeding gums, blistering, peeling, loosening of the skin, blood in the urine or stool, blurred vision, burning, crawling, itching, numbness, prickling, pins and needles or tingling feelings, chest pain or discomfort. So in order to overcome the side effects of drugs, you really need to take more Remag. I don't know how much you're taking, but it's not helping the side effects of your meds. And hopefully if your blood pressure effects or your palpitations are related to magnesium deficiency, if you are taking your 3 or 4 teaspoons of Remag and 1.5 to 2 teaspoons of Remite, then you could overcome your magnesium deficiency symptoms and not need medications that can be causing your restless legs type symptoms. And it was a good question to get, because there is a percentage of restless legs that is related to drug intake, the incredible side effects of drugs. So that's the mailbag arising from the question. A lot of good questions there. Thank you. And Ginny, back over to you for chat and phone calls.
Okay, wonderful. Nancy did have a follow-up question, which was basic, and she did say, I'll be interested in what I hear on this subject today, as even at 3 teaspoons of Remag daily, I have been experiencing light symptoms in my right legs at times. Not unusual for me, except my lower body structural history is likely a factor in just giving me a season of small reactions. At least I hope that's the case. So it seems like she's kind of consoled herself, and structural things and environmental changes and weather patterns and things like that are all to be expected, because we are using the products, but they're not in order to give the body the power that it needs in order to work with the environment that we're in, but we still are going to react to the environment.
Right. And, when people get the message that we tend to give out, and when people hear, well, with 1/2 teaspoon my restless legs went away, it can be very annoying for some people who have more going on, who are suffering longer, who take more of the products. But you're perfectly right. If there's some sort of structural situation where the alignment is off, yes, you'll have more symptoms on that one side, and it not necessarily related to magnesium deficiency. But of course, we say to people, if you've got symptoms in a joint or an area of your body, just slap on the Remag lotion or spray some Remag directly on the area. We used to spend more time talking about it before we had our Remag lotion, but you have a painful area, you have your Remag liquid in a spray bottle, you spray it and just dab it on. Don't let it run on the floor or anything, but just leave that to dry and spray in that way a few times throughout the day, and that Remag is absorbed and starts helping the pain and inflammation at a local level. So keep working at it, Nancy. Make sure you're also taking your Remite and your Realign. And if there's a lot of discontent or, angst about a symptom, that you really have to get into the RNA reset drops. And this is a great time to get them. They're at a 30% discount. I forgot to mention that at the top of the hour. The sale is still on. So if you already bought your supplies for the next couple of months, just go ahead and buy more and hand them out for every holiday and birthday, because this is a sale that we're not going to be moving for another millennia. So this is a major big sale that we want you to take advantage of, so we can we have less boxes to move to the new warehouse. So, Nancy, get your RNA reset drops going as well, is my advice. Back to you, Ginny.
Right on. Very good. Very good. Excellent. Now, I want to just let everybody know 602-666-6027 is the number to call into the show. And I see lots of callers on and no raised hands. So you've got to hit *5 on your keypad. *5 will raise your hand in the studio and let me know you have a question or comment, and then I can put you on in the order in which the calls come through. So, yes, I see calls coming through now. So very important to hit that *5. Let me just say, Carolyn, we don't talk a lot about the drops, and, we have a tendency to focus a lot more on Remag and the other formulas because they're more clearly scientific and that kind of thing, and you are, accurate, right in that part. But I will say, in the beginning when all we had was the drops, it was incredible the results that people got with especially the easing of their mind, the relaxing of their mind, the joy and the happiness. Yeah. They are very beneficial for that. Now, I know I multitask, but did I miss the awesome and amazing testimonial about the lady with her dogs?
Oh, my gosh. Oh, okay.
This gets coupled. Yes, this gets coupled with the coronavirus.
Right.
Because this is incredible what this lady is writing here.
Thank you. Yes, and she says, Eva says, I just want to give my results using Pico Silver on a cut I had on my leg for 2 months. I went to the hospital, and they had me treating it, and it was not healing. I started applying Pico Silver 3 times a day, and the cut healed within 3 days. I was so surprised. Also, 2 months later, we had puppies with our dog named Brandy, a pit bull, and the puppies were getting sick, and some did not make it. I thought Pico Silver would help the other sickly puppies that seems to have parvovirus, a deadly disease that puppies can get. I started rubbing Pico Silver in their mouth. Brandy did not want to feed them. After a few days, they were coming around slowly, and I put it in their water and started adding it to the food and with a little water. What a miracle. They are recovering very well. Thank you, Dr. Dean, for all your wisdom and your products. And then Ginny, we saw this email, and Ginny said, Parvo is deadly. I saw tons of it in the inner city. It gets in the ground and in neighborhoods, and the puppies die by the hundreds every year because people can't afford vaccines. This is freaking incredible. So, yes, who would have thought? Well, you would have thought of it, Ginny. I think you give your puppy dogs Pico Silver, but that is amazing.
Right, and let me just say that parvovirus is a virus that eats the intestinal lining of the dog, and which is why she didn't want to feed them, because they immediately throw.
Yes. Yes. The mother knew that there's just no point. Yep.
Yes.
Wow.
So but it is incredible that Pico Silver could stop that parvovirus, because I'm telling you, that stuff is just evil. So if Pico Silver can deal with that in a dog, and now what is the best blessing and the benefit of a dog? It doesn't have a mind. There's no mind there with the dog to say, or to focus on the fact that it's got something, or to listen to the news and wonder, and is this really enough, and should I go to the hospital? Nothing. So, that's the benefit of working with the dog, because it just takes the substance and the body's free to use it, and there's no interference from the mind or any resistance. But, boy, I'll tell you what, that I love Pico Silver already, but the minute I read that testimonial, I ran into my bathroom and gulped some down just on principle. Just anyway.
Yeah. Right.
Just to take some. I'm like, give me some of that. So that's pretty incredible, you guys. That's pretty cool.
Awesome. Okay, I just want to say this one. Someone wrote in and said a professional athlete took magnesium glycinate 150 milligrams daily several months ago and stopped due to excessive sweating during workouts after less than a week on it. No symptoms and no lab tests. He or she started because everyone needs supplemental magnesium. Several months later, restarted magnesium glycinate. The RBC magnesium test was 5. He was on it for about a month without any symptoms, then switched to Remag, quarter teaspoon. After 4 days on Remag, the excessive sweating returned, and he stopped it. He plans to start the Remite without the Remag. And this person who's writing in says, I understand that you probably think excessive sweating is not a problem, but would like your take on why this may happen at a certain level of magnesium in the body. The history indicates this symptom occurs at a certain level of magnesium, and is it possible that he just needs less magnesium? I would say taking magnesium and having a symptom after starting magnesium is due to detoxification. We have people getting rashes or getting revved up, and sweating could be one of the detox symptoms of magnesium. And the solution is not to take less. I mean, only quarter teaspoon causing that. That's only 75 milligrams. So it would be to keep taking it to kind of work through the sweat glands. It's like push the sweat glands to work more efficiently. But they're dumping, they're detoxing. The sweat glands are important to regulate the body temperature, so maybe something to do with temperature regulation. But, Ginny, I really haven't heard of that before. Have you heard of excessive sweating? And we don't know what that means specifically to this person, but have you heard of that symptom when people take Remag?
No, not at all. Not at all. I mean, that's a first for me, so I'm not familiar with that at all. Yeah.
Okay.
And usually, what happens with Remag, it's hydration, so it seems it would go the other way. The perspirate, the water would stay in the body and do its proper process. I don't know what's going on, but I've never heard of it before.
Right. Yeah, and we've had people who've started the Remag and gotten constipated and dry mouth and feel dehydrated, and we tell them, well, you're not drinking enough water and you're not putting your sea salt in the water. That has to happen as well. So perhaps that's another thing to make sure that this person is drinking enough water and putting sea salt in the water. Because certainly when you do the Remag, sea salt, and the Remite, your water goes into your cells. It isn't lost through urination and then, in this case, maybe through sweating. But it's an interesting question. Hopefully they continue the Remag and get back to us with what transpired or perspired.
Right on.
Okay.
Very good. Nice pun. Cute. Okay, let's take these last couple questions from the chat line, and then we'll move on to our phone calls. Thanks, everybody, for patiently waiting. It is worth it to talk to Dr. Dean here this evening, and we've got you covered. Let's do a phone call real quick before we get to the top of the hour. Let's go to area code 626, the great state of California. You're on the line with Dr. Carolyn Dean. If you could give us your name and then state your question or comment.
This is Rachel. And
hi, Rachel.
I'm taking a tablespoon of Remag, a teaspoon of Remite, a teaspoon of Recalcia, and everything's great, a lot better. I used to have the palpitations, but I'm wondering if I should take Realign. I do have a little bit of tremor in the head, and I know a nutritionist once said that was lack of vitamin B.
Well, I mean, we tell everybody that they should take the Realign, Rachel, just because it is a B vitamin, and we just don't tend to get it in sufficient quantities in our food. The Realign is food-based and methylated, so it's really well absorbed. It also has the 2 amino acids, the taurine, which is very supportive of the heart, and the methionine, which is a precursor to glutathione. So say the essential tremor in the head is related to some sort of toxicity, then the Realign does help to detoxify, and the Remag does as well. Go ahead.
Why do people say it calms them down?
The B vitamins are very calming. I don't know how else to put it. You know, they affect the nerves. You could go into the Dr. Carolyn Dean Live book section and download the free copy of Realign and read about it. That would let you know what you're taking and why you're taking it. But my decades and decades of work with natural medicine led me to create this handful of products that work together. They're very synergistic, and they do cover the waterfront. And
now
yep.
Your other product is Restructure. Is that the protein?
That's the whey protein powder also with pea and rice powder. It's got the RDA of vitamin C. It has the omega-3 fatty acids. It's like a protein, carbohydrate, and fat balanced meal replacement, and it does have the RNA reset powder in it as a catalyst, just to make things really work well together. And the other one is the Pico Silver that you'd want to have if at these times of viruses in the air. And the RNA reset drops themselves, as Ginny said earlier, they're our joy juice.
So if the RNA drops are in powder form and the Restructure, would I have to buy the drops?
Well, they work a little they're much more concentrated in the RNA reset drops. You're going to be able to get a lot more. But Ginny, how do we answer that? How are we seeing that they differ for people? The RNA reset powder versus the RNA reset drops.
Well, I mean, they both have the same thing, but you're just not getting the full effect. I mean, the powder is one aspect of it. It's like the difference between, say, getting the fiber in a grain of wheat versus the fiber in wheat powder. It's just not going to be the same because it's a derivative. It's of the whole. So I think that there is benefit to it.
Yeah, and it's only 22 milligrams, 11 milligrams in some of our products and 22. Yeah, we were just so sure that the RNA reset drops were kind of a miracle that we wanted to put a little pinch of it in as many products as we could to give people the benefits of it if they weren't going to get the RNA reset drops or couldn't afford it. I mean, it's one of these products that has to be made by hand, so it's very expensive to make. But
How much do you think I should take? I'm a 75-year-old lady that weighs about 160. I do drink enough water.
Well, the amount is usually 5 to 10 drops once or twice a day. So we get people to start with 1 drop. You may find at 5 drops a day that's fine for you, and then you'll get the benefits of it. The benefits being that the RNA reset drops help your RNA, your genetic RNA, make a cleaner copy of your DNA. So we're looking at them making more perfect cells. And in the midst of all that as well, as Ginny said earlier, you may have heard that when people started taking the RNA drops, they just felt better. They felt, more alive, more detached, not getting too involved in all the crazy of the world, and just being happy. And we can't deny that, but we can't prove it.
Now with the Remag, if someone takes it faster, that's when it causes diarrhea?
That's right. When you take too much to begin with, that's why we say to people, start with a quarter teaspoon, let that just settle in your body, a quarter teaspoon a day for 3-4 days, and then increase by a quarter teaspoon.
Rachel, hang in there just a second. We've got to take a break, and we'll come right back to you. Stay on the line.
Okay. Thank you.
You can also get updates and resources online by visiting drcarolyndean.com.
AchieveRadio.com.
What city plays?
The old categories. They don't apply anymore. And we're just superhuman, discarnate things right now.
What city plays?
We're well beyond the categories for men and women right now. And we're just superhuman, discarnate things right now.
Give me body.
Bring back the body.
Give me body.
Bring back the body.
Give me body.
I do advocate immediate fast to bring back the body.
Give me body.
Bring back the body.
Give me body.
Psychic radio, holistic radio, spiritual radio. This is AchieveRadio.com. Follow us on Twitter at twitter.com/AchieveRadio.
We return now to the Dr. Carolyn Dean live radio show, along with host Ginny Sanders. Phone lines are open during live broadcast at 602-666-6027. At 602-666-6027.
All right, everybody, welcome back. Hour 2 live with Dr. Carolyn Dean. Excited that you're here with us again. Thanks for tuning in. And also a reminder, if you're on the line and you do have a question or comment for Dr. Dean, *5 on the keypad is the way for you to raise your hand in the studio and let us know that you've got a question or comment, and then we can put you on the line with Dr. Dean. If you don't hit *5, your phone remains on mute and you won't be able to speak to her. Let's resume our conversation now with Rachel that we left at the top of the hour and Dr. Dean, and then we'll press on from there. Go ahead, please, Rachel.
I had another question about the blood testing that you're offering. And I know the organization's out of San Diego, and I often go down there because my daughter lives there. Can't I just go in and have the blood test done while I'm there?
No, they're not a lab, Rachel. They're a research facility that is organizing. They started with vitamin D research. They're organizing participants. The lab that is used is ZRT Lab, and I think that's up Seattle way. And the blood is not a blood draw. It's a finger prick that you do yourself, and then you put the drops on little circles of cardboard. So
okay.
It's a whole new way of testing.
So that's not going back to them. It's going straight to the lab.
Correct.
Okay, so being in San Diego wouldn't make it quicker or happen faster.
No.
Okay, well, I do have the pea protein. What else was I going to ask? I think I will try the RNA drops, and I thank you very much. And I'm the lady that had that spider bite that put the Remag on her head, remember?
Oh, yes. Oh, my gosh, what an experience. Okay, I know you now.
Okay. I'll never forget
well,
that.
hang in there. Yeah, put up the protection with all your products, and just stay as healthy as you can. That's all we can do. That's our defense against what's going on.
I never get sick. People at church say, well, don't come, if they're sick, they say, don't come visit me, I'm real sick. I said, that's okay, I don't get sick. And people just don't understand. It's, they get upset because someone comes to church with the flu. Well, you're not going to catch it if you've got your body strong, if you've got your immune system strong. And people just don't seem to get that. Thank you, Doctor, very much. Oh, the Yeast Connection book, I don't have a computer. Can I just buy it? I don't.
Yeah. I'll see what Ginny can do. Maybe we can print it up for you. It's kind of a long book, but you're such a good customer. We can probably print it up for you and mail it out to you. Or, you could have your daughter do it, or somebody nearby. Okay?
Yeah, I don't have anybody nearby that could print it. I've thought of that, and I know I need it because I have the itching of the ears, and I haven't been able to give up sugar.
Yeah, that's tough. Yeah, the yeast is like the Borg in Star Trek, where they just have their mind set on sugar and they make you crave it. Ginny, if you wouldn't mind getting one of our wonderful people to print that up for Rachel, I'd appreciate it.
Okay, Rachel, can you email support SUPPO? Do you have a computer?
No, I just have an iPhone 7.
Okay.
But I can email from my phone.
You can. Okay. Just email support SUPPORT at RNA Reset, and just put in the subject line for Ginny, and then send me your mailing information. We also have videos if you can watch YouTube on your phone. Carolyn does have a good YouTube video about that book that we did on yeast, so that might be helpful too.
Okay, so support RNAreset.com.
Support at RNAreset.com. Yep.
And just ask for a printout of the book.
Yes, please.
Okay, and you said to put your name on it?
Yeah, just put attention Ginny in the subject line, and then just send me your delivery address so I know how to get it to you.
All right. Thank you very much, ladies.
All
okay,
right.
Rachel, thanks for calling in.
Thank you.
Bye-bye.
Thank you. Bye-bye.
Okay, very good. We've got some more callers, but Carolyn, here's a question that's coming in actually from our live YouTube feed. We have a live YouTube channel through achieveradio.com, and that's where a lot of our hearing impaired listeners or fans watch us, because it's closed captioned and they can read along with the radio show. And one of those people is asking about Realign, and she's saying that she took the Realign capsule, just one every day, and she's been got her blood work back, and her B12 was 952, and so she's wondering if that's okay. I did ask her if she fasted the Realign prior to the test, but she hasn't responded to me, and I'm chatting with her on YouTube.
Right.
So
yes, high levels of B12 are innocuous. They don't mean anything. There's nothing dangerous about it. The normal range even is 200 to 900, so she's at the top level. And it likely is related to her taking Reline, but that's good. She's covered for B12. And she could be taking 2, and it could be a little higher, and it wouldn't be a problem either. Not a problem. We used to give injections of B12 for bursitis and all kinds of things. I mean, B12 is so safe. It's been proven over and over again that high levels have no negative effect whatsoever.
Right, absolutely. Yep, B12 shots. I used to do those back in the day. That was fun. It was something to do. Okay, now let's see. Yeah, it was something to do. It was fun. Everybody's like, I got my B12. I got my B12. It was like going to the gym. You just got your B12, and it was so cheeky. Okay, now let's see. Other things that are coming up on the chat line are, Nancy saying when you asked suggested Nancy about taking the drops, she said, thanks, Carolyn, for your feedback. The drops have been infrequent for me due to the cost for the ongoing use to be more consistent. I will use it regularly with the other products. I will reconsider getting some now while it's on sale, so that was great. And she did say another note is my restless feeling in my leg doesn't have pain or cramping. It's just a light feeling that causes me to want to move the leg. So that was her follow-up on that. Any comment?
Well, it does imply that there's some misalignment. What I tell people for misalignment is the EGOSCU exercises, EGOSCUE, EGOSCU. And I use the tower, and that does stop me from walking like a duck.
Wah, wah. You were walking like a duck? No.
Apparently, a little turned out. I
know. Okay, interesting, fun. Okay, Robert said, what does a restless leg syndrome look like with Remag? Is there less cramping? And I think we've talked about that enough, but he also asked, is Pico Silver good for lungs?
Oh, yeah. If I had anything going on with my lungs, I would be putting Pico Silver and Remag in a nebulizer and inhaling that, or putting it in a humidifier or a vaporizer. It's very good for the lungs.
Very good. Excellent. Let's go back to our phones. We'll go to area code 731, the great state of Tennessee. 731, you're on the line with Dr. Carolyn Dean. If you could give us your name and then state your question or comment.
My name is Priscilla, and I was wondering if Remag can be used like intravenously.
I don't know, Priscilla. They would. It could be, I'm sure, but they'd have to autoclave it. They'd have to, put it in a high temperature environment to make sure kill anything off.
Yeah.
So
yeah.
Yeah.
What I'm wondering, I mean, you had mentioned in the Magnesium Miracle about magnesium in the IV. Magnesium sulfate.
Or chloride.
And I thought Remag would be a whole lot better than magnesium sulfate.
Yes, and the Remag, if you picked up on some of the testimonials in there, one of our people, he had to be on IV magnesium for his terrible wasting, and he was able to switch over to Remag. And he felt it was better than the IVs because, when you take a few thousand milligrams of magnesium by IV, you lose most of it. And and then 2 days later, you're dropped down again.
Yes.
Right.
Yes.
Up and down
So,
like a yo-yo.
Yeah. Like last summer, my sister was in the hospital with needing surgery.
Mhm.
And she couldn't eat. If I would have rubbed Remag on her skin, that would have been good. And she would have gotten the magnesium.
Exactly. Yeah.
Okay.
Before we had the Remag lotion, people were telling us that they'd mix Remag liquid into a hand cream and go in and rub everybody down with it, or just because as soon as you say to the nursing staff, oh, I want to do this, they'll say no. That's
I know.
the trouble. Yeah.
I know.
You've been there. You've been there.
I've been there, and I'm a stubborn nut, but I like my Remag. Thank you very much.
Thank you, Priscilla. It's really sweet of you to call in.
Yes.
Bye-bye now.
Bye.
Well, that was sweet. Very sweet.
Mm.
Okay. Barbara's asking, what about nebulizing Pico Silver for asthma? Could you substitute it for albuterol and Brio? And if so, how would you make up that dosage then?
Well, I don't know how the nebulizers work. Usually it's an amount of saline in the container, and then you add the drug. Personally, I would use the saline and put in a teaspoon of Pico Silver and go from there. But, I mean, it'd be good if a person could talk to their doctor or naturopath about it and get some input, or maybe they could Google around and see what other people are doing with silver liquids. Because I know there's some companies that talk about that, have done research on it.
Right, very good, excellent. And then the only thing you want to just keep in mind is Pico Silver's 2 times concentrated, and it's in terms of the dose, and then it's also more concentrated in terms of having a stabilized ion. So you probably want to start a little bit lower, right, Carolyn, than those other brands?
Yeah, we have 20 parts per million, and most brands on the market are 10 parts per million. Professional grade may be 20 parts per million. Yeah, I mean, the FDA won't let us talk about using it in this way. That's why we're, dancing around it a little bit. But what's amazing about our Pico Silver, it's its own preservative. It does not have anything else in it but Pico Silver.
Right on. Very good. And also, would you do that with Remite? She's asking, Barbara, would you do that with Remite?
I don't think so. I would do it with Remag. Because when I was first working with the Angstrom magnesiums, I was hearing reports from people about using Remag as a nebulizer, especially for things that tighten up the lungs, like for asthmas. The Remag liquid, and our Remag liquid now is its own preservative, so it doesn't have anything in it besides just magnesium chloride.
Very good, very good. All right, excellent, excellent. Okay, and Darlene wants to know, can you boost up potassium with the salt substitute, like no salt, or is that really not absorbed?
Yeah, I think in my Magnesium Miracle book, I talk about the different salt substitutes, and there are high potassium ones. And yes, if you're looking for more potassium, that would be a thing to do, but at the same time, you do want your sodium. I mean, the people who have adrenal fatigue and a lot of adrenaline reactions, anxiety and whatnot, they really do need that sodium. So it's going to be used up if you're using it to support your adrenal glands.
Very good. Very good. Excellent. Excellent. All right. Excellent. Okay, let's see where we are. I think we're caught up with everything that was on the chat line, and I think we've got a couple more phone calls, 602-666-6027, so we'll take those calls. Let's go to area code 919, the great state of North Carolina. You're on the line with Dr. Carolyn Dean. If you could give us your name and then state your question or comment.
I'm Regina in North Carolina. My question is, which of your products will help with a heart murmur and pulmonary hypertension?
Well, with Regina, we don't look at our products like they're drugs. We're looking at them to support the body. Now, is is the heart murmur like a mitral valve prolapse, maybe?
I'm not sure. She was saying that it's something that she hear in an older person.
Right. Yeah, maybe an aortic stenosis or something. If the heart murmur has to do with calcification around the openings in the heart, you can get a calcification, then you can hear the heart sort of burbling away through that calcification. Well, the REMAG, our magnesium, will help dissolve calcification in places where it shouldn't be. And the pulmonary hypertension, that's a tricky one. That's where, the pressure in the lungs is elevated. Now, we were just talking about nebulizing REMAG for asthma in the lungs. It would be interesting. I love people to do some research on using REMAG in a nebulizer for someone with pulmonary hypertension, because what the magnesium does is it relaxes the blood vessel, it relaxes the muscles, it relaxes the nerves. So it might have an effect directly, but also by taking the REMAG by mouth, it should be able to help pulmonary hypertension. But again, we're acting like it's a drug, but our whole, handful of products are helpful to support the structure and function of the whole body, which is what you want to be doing.
Okay. I'm definitely trying to stay away from the drugs, so the medication.
I know. It's pretty easy to get those drugs going, and it's pretty hard to stop them.
Oh, yeah, that's true.
Right. Okay, Regina, we good for now?
Oh, yeah, I'm good for now. Thank you so much.
Okay, sweetheart. Bye-bye.
Bye-bye.
Okay, excellent. Let's go. Margaret's typing in on our chat. Hello, Margaret. Good evening, Carolyn and Ginny. I was wondering how much vitamin D and K should I take, as called the Green Pastures Company, and asked for the levels allowed for their product in Canada. And they said vitamin D2 is 2,145 units, and there is 119 of vitamin K. In the very near future, I want to take advantage of the lab testing. A few months back, Bill and I were both low in vitamin D. I thank you in advance for your answer. I so appreciate the both of you. Aw.
I don't quite get it. It sounds like Margaret gave us information about what, Blue Ice Royal?
Yeah, because she said I called Green Pastures, asked about the levels allowed for their product in the Canadian market, and they said vitamin D2 is 2,145 units, and there's 119 of vitamin K. So she's just asking what level she should be at in order to do the lab test, considering that they had low vitamin D previously. How much should they be taking?
Well, that's where, with the Blue Ice Royal, I was doing 2 capsules a day. and my vitamin D was pretty low, so that's where I went to the, the Naturello vitamin D3. I don't know why they're talking about vitamin D2 because we want vitamin D3, so I'm going to have to figure out what Margaret's saying there, or maybe she could write another email. I don't know that taking 4 or 6 green pasture is going to work, and that's going to be very expensive, actually. So I don't have a good sense of her question yet.
Okay. Yeah. Okay. Very good. All right. So, Margaret, listen to what Carolyn said and see if you want to respond. Or, call in if you'd like to. We'd love to hear from you, 602-666-6027. Okay, Nancy is following up to your comment about the walking. She said, funny about the walking, I'm familiar with the Egoscue Tower from way back, but I never got one. I walk pretty easily in spite of a weaker left hip, low back situation. I still need a chiropractic support for my whole body at times. Much improved through the years and a long health journey, but very long-standing from a young woman. I have concluded a lot of that was nutrition insufficiencies, definitely yeast overgrowth. All the stuff that gets covered with you and your great education. MCS, multiple chemical sensitivities, as the years moved on, was also huge for me. So that's her summary of her experience there. Very good. Thank you, Nancy. Okay, let's see. Area code 352, you're on the line with Dr. Dean. If you could give us your name and then state your question or comment.
Hi, this is Rhea in Florida, and we were talking about putting silver in the nebulizer or the Remag, but they told me I have to use a sleep apnea machine. Can I put the silver in with the water, the distilled water that I use in my sleep apnea machine at night?
I personally would, even if you think of it as being something that will keep the well sanitized. Yeah, that would be a great way to use it.
Oh, I didn't even think of that. That would be good because I never know for sure if I should trust the apparatus that I purchased to clean it, that just sends some kind of ozone or something through the tube and everything.
Right.
So what? Maybe a teaspoon in per dose at night.
I think that's
teaspoon?
what I would do. Yeah,
okay.
Like Jenny said, start out maybe with a half, and it'd be interesting to see how your sleep apnea improves.
And also, after you talked about that, you talked about lung problems, and they've told me that I have nodules on my lungs, and every 6 months I'm supposed to go for CT scan, and I'm the one that called in a couple weeks ago with shingles. I still have shingles on my scalp. That's horrible. But the nodules on the lung, maybe putting that silver in the sleep apnea machine would be a good idea for that as well.
Yeah, that would be very interesting. Yeah, and are you're spraying Pico Silver and Remag on your scalp shingle residual?
Well, I did put, right after you told me that, I think it was 2 weeks ago, I did put, or maybe it was a week ago. Anyway, I put the silver and mixed with the Remag, and oh my goodness, it made me itch so bad I couldn't stand it. Then I did it again a second time the next night before I went to sleep, and again I had this severe itching, which I do get itching, with this situation here. But I just didn't use it for that. I couldn't stand the itching was so bad.
Interesting.
So,
well, I wonder if the silver alone would be better because the Remag it can be strong. So I would just do the Pico Silver.
I do the silver, and that seems to be more feels better. So I just do use it. I use the silver on my shoulder and my ear and my scalp. And okay, all right. Well, thank you very much. I appreciate that.
Okay, Rhea. But just one question, Rhea. Are you still there?
I'm here.
I'm wondering, do you think maybe a conversation with Dr. Holt, our total biology practitioner, would help to try to figure out what, why these shingles are still dragging on, if there's a conflict related?
Maybe I should. I don't know. How much does he charge? Or if I go on your website, will
you can
know
go
what?
to his
The
website.
first hour consultation with Tim, Rhea, is at no charge. He'll book an appointment with you, and he will talk to you about your concerns and let you know what the likelihood is of him being able to help you, and he won't charge you for that. And after that, if you decide you want to work with him, then he will charge you, and I don't know what his rate is right now. But you can at least get a sense of who he is and what he's about.
All right.
And, yeah.
Where can I get his number? Is he on your website, or just put in Dr. Holt in the Google thing?
It's the Google thing. What's his website? True.
Turnpoint Health. Turnpointhealth.com.
Turnpoint Health. I got to write that down. Okay, I'll try that too. All right. Thank you so much.
It's dragged on way too long. It shouldn't be there. And when there's something there, what kind of niggling message is it trying to give you that he can help you perhaps figure out? I would definitely do that, especially if he's offering a free little visit. That would be awesome.
Yeah. Okay. I'll look him up. Thank you so much.
Okay, great, Rhea. Bye-bye.
Thanks. Bye-bye.
Okay, excellent. Going on to area code 434, the Boston area, on the line with Dr. Dean. If you could give us your name and then state your question or comment.
Can you hear me?
Yes.
Hear me?
Yes.
Hello?
I'm hearing you.
Okay. I'm sorry. I'm not used to using the cell phone. It's my son's phone. This is Barbara. How you doing, Dr. Dean?
Very good, Barbara.
Thank you for taking my call. This is the first time I've called in, and I've listened to you before, but just hadn't had time to call in. I have two questions. The first one's about me, and the other one's about my son, but I'm a 54-year-old type 1 diabetic. I had my red blood cells checked, which was 5.4, and that was probably about a month ago. But this dates back to 2018. I started having some soreness in my index finger joint, and I thought it was a job I had, but it progressed from that finger to my ring finger, and then a year later, this past summer, it went to my left hand index finger, ring finger. And they're very stiff, and I think it's that Dupron's contracture or whatever you call it.
Oh, and, Dupuytren. Yeah.
Oh, Dupuytren. Okay, I didn't know how to pronounce it. But they're sore and everything. I don't know if it's that or not because it says your skin is tight, but my skin doesn't feel tight. It just feels like my ligaments are swollen and just really tight. Like if I drive the car, my hand gets shaped, my finger gets shaped to the steering wheel and stuff like that. So I was kind of curious of what you thought, if that would be helpful with anything that you use.
Well, yes. I mean, if it is Dupuytren's, it's, it usually happens in males who have work that, where they work with their hands and it's like an occupational condition. Has a doctor looked at it and examined it?
No, because I try to doctor on everything myself, but I really just haven't been to the doctor due to funds. But it started from a custodial type job where I did mopping, and that's why I thought that it started it. But then it moved to the other hand, and I hadn't done that job in a year, so it wasn't brought on the second time by the mopping. So. So I'm not really sure it's that. From what I was reading, that sounds like connective tissue problems, and I do have frozen shoulders and stuff like that. But anyway, And I didn't know if that could be the magnesium.
Yeah, I mean the magnesium should be able to help. You would get the Remag lotion or the liquid, and just spray it on the area or dab it on and let it dry and work it in, because even if it is Dubitrons, it can help with the inflammation that you said. It's like your ligaments are swollen there. And you can put it on your shoulder as well, because it's anything to do with the muscles and nerves. The magnesium, getting it right into the area can really help. So that's the place to start.
Okay. And then my second question is probably a quick one. My son has sweaty hands and hates it. So I heard you talking about sweaty hands and stuff earlier from taking the magnesium. Do you think that could be related to magnesium, the sweatiness?
Well, it's hard to say when they have a word for it, hyperhidrosis. It's I don't know if we've ever come across that. Ginny, do you recall if anybody says that their hands are less sweaty?
Yeah, I don't know. I really don't know.
Okay. All right.
When you look it up, it says alcohol, drugs, hormones, spicy foods, stress, and diabetes.
Yeah.
Does your son have diabetes?
No, I have type 1. My sister has type 1. No one else in my extended family has type 1. None of our children, which we fooled around at chemical exposure when we were younger, when we worked on a tobacco farm. I don't know if that did it or not, but either way it goes, both of us have it. None of our children have it. But he's actually had the GAD-65 test and different tests that test for type 1, and he's never come back positive.
Right. Yeah, I don't, there's nothing I can think of for the hyperhidrosis except, just maybe taking the minerals, the sea salt in the water, and taking some Remag and Remite to try to redistribute the sweat so it doesn't come out on his skin. Because if you're, people who get swollen ankles, for example, they are actually dehydrated and mineral deficient, and you can balance things out if you take your minerals, your sea salt, and drink proper amounts of water. And you've heard me talk about that. You take your body weight in pounds, divide that in half, and drink that many ounces of water a day. And into each liter of water, you put a 1/4 teaspoon of sea salt.
Okay. All right. Well, thank you so much for your time.
Oh, you're welcome. Thanks so much, Barbara, for calling in. Appreciate it.
All right. Thank you. Bye-bye.
Bye-bye.
Okay, let's see where we're at here. I think we've got the great state of Michigan, area code 248 on the line with Dr. Dean. If you could give us your name and then state your question or comment.
Yes, my name is Denise. I've called before. I thank God for when I heard Regina and I think it's Rhea, the one that had the shingles. Their questions, you basically answered my question. One of them had to do with pulmonary hypertension, and the other one when she was talking about sleep apnea. And I'm listening to you guys talking about the Pico Silver, and so I was wondering, you mentioned about spraying. Is it okay to just take it in your water with your Remag as opposed to spraying it and stuff like that?
Oh, of course. Oh, of course. Yeah, we were talking about it. Yeah, being used in nebulizers and vaporizers. But yeah, absolutely, Denise. Most people just put in their drinking water along with the Remag and Remite. Right.
Oh, great. That's all I needed to know. Oh, no, last one was with the atrial fibrillation. Both my brother and I have been diagnosed with that. But he can walk, and he doesn't have that shortness. Well, he takes something for his pulmonary hypertension. You know, the medicine is something. And so that's why I was thinking, oh, my gosh, I didn't even think you could take something for something like that. But the one thing about him, he can walk and get around and do everything. But I walk, and I'm out of breath just walking a few, inches or so, and then I start and then I stop, and it's just, I felt like my quality of life has just been curtailed. And I want to get back out and do all the things that I used to do. So I know that that's why I'm starting your, after all these years, I'm starting all your products. I bought everything. And
good.
I just started, so I can't come up with how I'm doing. But I'm just praying that if I add the Pico Silver, would that make a difference? Would it help with maybe me being able to walk a longer distance without having that shortness of breath, or just to get the quality of life back?
Right. I mean, the shortness of breath can be that the heart doesn't have enough magnesium to strongly push the blood in and out, and that causes a bit of pressure in the lung area. Or you could have something like yeast overgrowth, and that's affecting the lungs, and certainly the Pico Silver is going to help there. Okay. And the Remag is going to help your heart. So, you just keep saying the worst is over. I'm on my protocol, and I'm going to be just fine. And that's the way you approach it.
Amen. That's what it was, because I've just had enough of the crying spells, and I just really want to get off of these blood thinners and beta blockers because I've had such negative response with these blood thinners, and I just don't want to be on all of this, and I'm just believing that, I'm going to take your products religiously, faithfully.
Yeah.
And I want to call back and give a good praise report. So.
You will, Denise. You will. You've got, if you heard some of the people over the years, Kendall, for example, she would call in every week and just break right down and just be so miserable, and then she'd pick herself up and say, okay, I'm going to continue on, I'm going to get better. And now she's running her own fish company in Philadelphia and telling everybody she meets to come on the show and take the product. So yeah, you'll be like Kendall.
Absolutely. I appreciate all of this. Now I can rest and feel better because I'm like, okay, now I'm working my way up these teaspoons. I've got them all.
Yeah.
The only one I don't have is the Realign, not the Realign, but the drops. That's the only one I didn't get. It didn't come with the kit I got from Amazon. So.
Oh, right. Okay.
So
you can get those. Yeah, you can get those from our website. But yeah, it's just slowly but surely. Don't push yourself. Don't say, I'm going to go out and I'm going to walk. I don't care. You cannot overdo yourself right now. You put yourself into lying down therapy and just saying positive affirmations. When you have a good half hour, you just praise that half hour and you say, I'm going to have another good window of good health. Pretty soon you just talk it up and your body will listen to you, because otherwise, our bodies will hear us when we say, I hate these drugs, or they get so many side effects. Well, the drugs can be saving your life right this minute, but it doesn't mean you have to have them forever, because you're going to, praise your drugs too. Yeah.
Man, I didn't even look at it like that, but that's an excellent way. I appreciate all of this, and I will be calling you guys back for a praise report. And you guys have a blessed day.
Thank you, Denise.
Thank you.
Amen. Amen.
Bye-bye.
No, what a sweetheart. Very, very sweet.
Yeah. Mm-hmm.
Yeah, I love all of our callers. They're always so sincere and precious. Very, very precious. Hold on. Speaking of another precious soul, Margaret, are you there?
I'm here.
All right. Hello, lady.
Hi, my gosh. Now I'm so excited I won't be able to remember what I wanted to ask you.
It has been a while since we heard you on the phone. This is wonderful.
I know. Oh, my gosh. I just listening to you help that lady, and my heart just goes out for all the things you're doing. Oh, I'm telling you. One day we're going to meet, Carolyn. I don't know when, Ginny, and we're going to meet. I don't know when or where, but it's going to happen.
So exactly.
What I was wondering about was we buy the green pastures here in town at the chiropractic office, and I was curious about their levels for the Canadian market because I know that there's different levels allowed in each country. So I called Green Pastures, and this is what these are the numbers they gave me. So I thought, what does that mean I have to do in vitamin D? This is D2. So does that even equate? Does it even, I don't understand. And then the 119 in vitamin K. In the near future, I want to take advantage of the lab testing with the Grassroots Lab. I think that would be really good. And I thought it was very interesting when she was on your show. I heard her say that it's very important to do it at the same time of day when you retest. I thought that was really interesting. And so I'm just wondering, for Bill too, I think the D may be a really important factor for him. And you know what our Canadian winters are like, and this winter has been kind of ridiculous. Not a lot of sun and a lot of rain, and then snow, and then rain again. But I was just wondering, what maybe I should be looking at. I don't know the D you spoke about. I don't know if I can buy that here or not. I've never heard that name before. But, I can try and see. My doctor is functional integrative, so maybe he can help me with that. But I was wondering what you thought, how much we should be taking in D, or again, is that going to depend on the testing that we get done in the future?
Yeah, it does kind of depend on the testing, I think, but I'm kind of moving toward doing at least 2,000 units, but I say a D3. And with them talking about D2, I think we'll have to phone Green Pasture and ask them what on earth they're, why is there a D2 in their product? Is that what they're saying? Because the sources of D3 are oily fish and fish oil, which is and liver. Which is what, cod liver oil is what we're getting in the blue ice royal. And the sources of D2 are mushrooms, and then they say fortified foods and dietary supplements. So I can't imagine that the blue ice royal is a vitamin D2. Doesn't sound right at all.
I mean, I could have it, incorrect, but I could have heard it incorrectly, but I thought that's what they told me. And so I think, for Bill's cognitive issues right now, I think that the D3 could be really important for him. We're also finding out that a lot of this is stemming from the lack of hearing. My goodness, I'm finding out so much about sound for the brain. And the disparity between one ear and the other, and this is a doctor of audiology we found, and he actually adjusts the frequencies in the hearing aid. We've never had anyone to be able to do that before.
Oh, interesting.
Because that's what he needs, not volume, because it never worked. But I didn't know why. And they thought because he was a woodworker for so many years, we built everything here, and that possibly that's why he has such disparity between one ear and the other.
Yeah, he put his saw was too close to one ear.
Yeah, and the same with the wood planer. That's a terrible sound. But, we're invincible at a certain age, we think.
Right.
So I'm just trying to, cover all the bases and you know, do what I can. And but we're on another yeast program, and it's a week into it, and I think I'm noticing some changes already. So it's amazing.
Okay.
He doesn't get the sugars here, but
yeah. Well, good for you. Yeah, that's the thing about you, Margaret. It's just you just never give up.
No, I don't.
Like, if there's a problem, then let's find a solution. Just don't take anybody's word for, oh, well, you just have to live with it. I mean, look what you find out about Bill's hearing. That's amazing.
Yeah, it was just amazing. And then right now, the Brain HQ, they've put a certain program for him on default, but only every second day because it's very, very tiring because new neural pathways are being created.
Wow.
So it's very tiring. So he can only do a half an hour every second day.
Mm-hmm.
But I'm very optimistic. I just, you know, we know the brain is neuroplastic today, and I know that this is going to be. The doctor gave us 2 to 6 months to see 40% improvement.
Mm-hmm.
As long as it wasn't vascular, and I would doubt that because of being on magnesium now. It'll be almost 5 years, Carolyn, the end of March.
Oh, my goodness. Wow, wonderful.
Yeah,
it seems to me that Margaret's voice is very strong.
Yeah, your voice is strong.
Yeah, well, I'll tell you, without your products, I just don't know. I cannot imagine a day not being on them. I have not missed a day in almost those 5 years. And I kid you not, it's amazing. Like I've been playing around with dosages, as I mentioned last week, and it's just amazing. Like even when I play around with them, I can still up at another half a teaspoon, depending on the day, you know, and depending on my coping that day.
Right.
But it's all good.
And then taking care of Bill, you have to be strong. I mean, you have to go to these doctors, and you have to say your words, and they have to listen. And if they don't listen, then you say your words louder. I mean, that's what's happening.
Right. That's what I do. And like I'm just a week ago, I thought maybe I was experiencing a little bit of burnout, but I think I'm in there. I think I'm okay. I think I just been resting a little bit more, and I just upped my dosages, and now the RNA drops are back on, so that's really good. So I just got another order the other day, so so it's good, you know. And did you know that dance is really good for the brain? Dancing.
No, of course.
Wonderful.
Because you're using both sides of your body.
Yeah.
And, Oh, very good. Oh.
Yeah, and we're doing that, just the two of us, just a little bit of dancing, a little bit of fun.
Yeah, that's wonderful.
Oh, dear. Anyway, I thank you so much for taking my call, and it's just lovely to speak to you again. And Jenny, thank you so much for all you girls do. It's just phenomenal. It really is.
Thank you.
I try to pay forward. I try to pay forward all the time because I believe so much in what you're doing. Your integrity is above board.
Thank you. We appreciate you.
Thank you. Thank you so much for being there for people. It's wonderful.
Yeah.
Thank you.
Yeah, give Bill a hug for us.
I will for sure. Thank you. Bye-bye.
Bye, Margaret. Bye-bye.
Bye.
Cool.
Outstanding. Oh, that was so wonderful to hear from Margaret. We just love her. 5 years. Yeah, she's been a major anchor in our customer base. She's just so wonderful. Just love her. Love her very much.
And she does pay it forward. She just, she'll create little groups of people and sit them down and tell them what to do. It's amazing.
Yep, and another one of our very good customers who we love to death from 2013 that we met in Chicago, our dear friend Alice is listening tonight. I know she doesn't want to speak to us. She doesn't usually get on the phone, but she's listening, and it's always good to look there and see her name. And Michael from New Jersey, Kulikowski, who's always tuning in and listening. We have such great customers who've been with us for such a long period of time, and they have, healed their bodies or sustained their health or inspired themselves one way or another. And it's just absolutely fantastic to see the the community of people who've gotten involved in what we're doing and who stay around, and that keeps us inspired for sure too.
Right, and it's shifted these past couple of years as we all get to know how valuable the products are and how effective they are. It's easy just to say to people, look, you have to do this. Before, in the first few years, it was, well, nobody listens to me but now people are listening. You go back out there and you just start talking about it because people are ready to listen. I know they are.
Yeah, absolutely. Let's see if we can grab this last call from the great state of Virginia, 757. You're on the line with Dr. Dean. Did you have a question or comment this evening?
Yes, ma'am, I do. I was calling about I have been told I have Funk's disease, which is.
Could you speak up just a little bit, love? Speak up a little bit.
I was told I have Funk's disease.
Parkinson's?
Funk. Endothelial dystrophy.
Endothelial dystrophy, okay.
Yes.
And what are the symptoms? I'll look it up. What are the symptoms? And, are you able to speak up a little bit?
Hello?
He did type into the chat line too, Carolyn, and he said, what can be done for FUCHS dystrophy? Can Pico Silver be put in a nose spray?
Yes.
That's what he was asking
absolutely.
About.
Yeah, it absolutely can. I mean, it looks like it's something about the cornea. I mean,
yes.
We're not able to do, say, medical things, but certainly, for my eyesight, I've been using our RNA reset drops. I'll put a drop in saline and use an eye cup and do that once a week. We've had a lot of people using the Pico Silver for all sorts of eye infections, either in an eye cup or just dropping it in the eye. It has no preservative, as I said earlier, so there's nothing that's going to irritate. But if it's such a rare condition, we haven't talked about it. But if you're willing to use a Pico Silver and try it out, we'd like to hear from you your reaction and whether or not it helps.
Well, I've used Remag, and I've noticed that I do not see the halos around the light so much as I was.
Right.
If I would look at the light, I would see halos around it. And now it's been using it for about 3 weeks, and it seems to have helped.
Right. And how are you using the Remag? By mouth, or are you diluting it and putting it in the eye?
By mouth.
Okay,
Orally.
by mouth, good. Orally, yeah. Well, yes. I mean, keep at it and think about adding the Remite as well, because with the eyes, they depend on the minerals, and also vitamin C is very important for eye health, and certainly the Pico Silver.
How would I use the Pico Silver?
I personally would put several drops in saline in an eye cup, or we have had people. Ginny, didn't you say Greg, when he had a bit of an eye infection, he just put the Pico Silver drops directly in his eye?
He did, but Doug in customer service has actually been using a Pico Silver drop in his eye every day to improve his vision, and he believes he has experienced an improvement in his vision. And we know that magnesium does definitely play a role in how it's affecting the retina, and also with the treatment of glaucoma. So I think between the oral magnesium and the single drop of a Pico Silver, you should be able to experience some good success with that.
Right. I mean, what's amazing about this stabilized ion of silver that we have created with the Pico Silver is it supports stem cell production, for Pete's sake. So you could be taking it orally as well to produce new stem cells for your eyes. I mean, that would be incredible, to get the corneal stem cells activated. That's what I would tell my body that I was doing. But we're at the top of the hour. Hopefully that's enough information to get you going, okay?
Okay, thank you very much.
Oh, thank you. Keep in touch. Thank you.
All right, great show, Carolyn. Thank you for your heart and your desire and your commitment and your willingness and your information and your wisdom and your beauty and your grace and your fun and your passion and your joy and your everything. Thank you, Carolyn.
Yay!
Thank you, Ginny.
Thanks, Ginny. Thanks, Bill.
Bye,
Thanks,
guys.
Bob.
You've been listening
Thank
to
you,
the
listeners.
Carolyn Dean Live Radio Show.
The sale is still on. The sale
For
is
questions
still on.
about today's show, email Dr. Dean at questions@drcarolyndeanlive.com.